BMI Healthcare performs thousands of knee replacement operations each year. It's a common and very successful procedure. However, it's still a major operation and one that needs to be prepared for. Research shows that patients do best when they are well informed and take an active part in their own recovery.
Well, knee replacement is quite a big operation during which the arthritic damaged joint is literally removed and replaced with man-made pieces, usually made of metal on the end of each bone and a polyethylene insert between the two pieces of metal. We sometimes also have to resurface the kneecap or the patella, and these pieces are fixed to the bone normally with cement. There are also some prostheses that can be put in uncemented. Most patients these days would tend to have this done under a spinal anaesthetic, where they put some local anaesthetic into the spinal fluid, making essentially the patient numb from the waist down. And if the patient doesn't really want to know what's going on, they can also request some sedation in the operating theatre. In my experience, it's quite rare these days for these operations to be done under general anaesthetic. The type of prosthesis very much depends on the surgeon's experience and, to a certain extent, choice. We tend to use prostheses that are proven to be long-lasting. Some patients are more suitable for a partial knee replacement, others for a total knee replacement. The majority of patients are best for a total knee replacement, but younger patients with only one compartment worn may be selected for a partial knee replacement.
Most people who have knee replacement surgery make a full recovery and don't experience complications. However, any surgery poses a risk.
With any big operation or even some smaller operations, there can be complications. The things that we're most paranoid about and trying to prevent are infection. Infection can happen either soon after the operation is done or later on in life if an infection gets into the bloodstream and settles in the joint replacement. We do take precautions by screening people beforehand, and we give antibiotics at the time of surgery. We do the operation in a very clean theatre, but it could still happen. The risk is generally around about 1%. Slightly higher with certain medical conditions. Patients do need to be aware that this could be something that happens, in which case it might need surgery to deal with it. The second one we're most worried about is blood clots. When we're walking around, the muscles in the leg are pumping the blood around, keeping blood flowing back to the heart. When we're less mobile because we've had a painful operation, there's a risk of the blood forming a clot in the leg called a deep venous thrombosis. We take precautions against that, both with some drugs and also with some mechanical devices that help the blood flow. But if it happens and the blood clot forms, it could break off and go into the lungs, and that could cause a blockage to the blood supply of the lungs, which is called a pulmonary embolus, potentially life-threatening. The risk of dying from a knee replacement is small, but it's not zero, and that's very important for people to understand. Post-operative pain can affect up to 20% of patients, and although it's usually self-limiting and goes away with time, there are a small group of patients who have pain and stiffness in their knee and are not quite as happy with the outcome of the operation as they were hoping they would be. Of course, even though we do lots of these operations, there is a risk of something important in the leg getting damaged. There are some big nerves and blood vessels around the knee which we need to know about and try to avoid damaging. There is a reported incidence of patients essentially being allergic to their prosthesis. This is incredibly rare, and in my experience I haven't seen it. Usually those patients might know that they were allergic to certain metals before they start, and that's helpful information, and it might direct the surgeon to use an alternative prosthesis. All knee replacements eventually wear out if they're used for long enough. And so one of the things that's always discussed with a patient is that they might one day need the operation done again, particularly if they're fairly young. Essentially, man-made materials will eventually wear out. A revision knee replacement is something which has to be discussed at the time of the first operation taking place.
If you do have any questions about the procedure, however big or small, be sure to ask your surgeon or another member of the BMI Healthcare team. We're here to make you feel as comfortable and informed as possible.